Hi everyone, this is Arundhati from Neethus Academy. Are you preparing for the OET writing test and struggling with the discharge summary? Don't worry, in this video, I will break down everything you need to know to write an effective discharge summary that meets the OET standards. So let's get started. So before going on to the topic, let's discuss what is OET writing test. This OET writing test is a test which is specifically designed for the healthcare professionals in a healthcare setting. Here is what you need to focus on. The first one is the logical presentation of the medical information. In OET writing, presenting medical information logically is to ensure clarity, coherence, and professionalism. The second one is the professional tone and the language usage. In OET writing, you need to use a formal and an objective tone and use a neutral, respectful language. For example, the patient is suffering a lot from back pain. This is an informal one. So instead of that, you can use the patient reports persistent lower back pain despite ongoing physiotherapy. Next one is, instead of commands, you can use polite request or recommendations. For example, it would be appreciated if you could. Next one is correct grammar, punctuation, and spelling. Use formal grammar structure such as passive voice where appropriate. And the last one is use of appropriate medical terminologies. So let's move on to the topic. What is discharge summary? A discharge summary is a crucial document that communicates important patient information to another healthcare provider or professional. Writing it effectively is essential for ensuring continuity of care. Now let's discuss regarding what all are the key components of a discharge summary. When writing a discharge summary in OET writing test, please keep these points on the mind. The first one is the patient details. In this, you need to write the full name of the patient, gender, age, and the admission details. The second one is the diagnosis or the admission summary. Here, you need to write or mention the primary diagnosis and any other secondary conditions. The third one is the treatment received or the treatment given. Here in this, you need to summarize what all are the treatments, medications, procedures, and therapies provided to the patient. And the fourth one is progress and response or the discharge status of the patient. In this, you need to mention how the patient responded to the treatment and management, the improvement of the patient, and the current health status. Fifth one is discharge plan or the post-discharge care instruction. Here in this, you need to outline if there is any referrals, medication instructions, and follow-up care. And the last one is recommendation for healthcare professionals. In this, you can mention if there is any specific instructions for ongoing treatment. So let's move on to the next topic, how to write an ideal discharge summary. To build a good OET discharge summary, you need to keep the following essential tips in your mind. So the first one is read the case note carefully. Read and segregate the important information in the first 5 minutes. Highlight the key information such as symptoms, medical history, and follow-up. The second one is organize your letter correctly. In that, you need to look for introduction, the purpose of the letter, patient background and admission information, treatment provided, condition at discharge, instructions and recommendation for follow-up. Third one is professional and formal in tone. The fourth one is be grammatically correct and proper in sentence construction. The fifth one is preserve logical order and coherence. Now let's look what all are the common mistakes that need to be avoided in writing a perfect discharge summary. The first one is overloading of information. Second one is missing important patient details. Third one, using improper tone and format. And the last one is not maintaining a logic flow. Before winding this video, I need to remind you one thing, that practice is key. You need to practice writing sample discharge letter, get feedback, and refine your writing. By mastering these strategies, you will be well prepared for the OET writing test. That's all for today. Thank you for watching and good luck for your preparation, and I will see you in the next video.
Neethus Academy, India's #1 language academy.